esophagitis because the story is not that old. Really, the first kind of description of patients that were thought to have eosinophilic esophagitis started to come about in the 80s, and then really in the late 80s, there was a researcher named Atwood that had a couple of seminal publications that really set the stage for what then become the defined and circumscribed diagnosis of eosinophilic esophagitis. First case series that was published as an abstract in 1989 called Esophageal Asthma and Episodic Dysphagia with Eosinophilic Infiltrates, where he distinguished patients that had features of eosinophilic esophagitis from patients that had features that were more consistent with gastroesophageal reflux disease. In a follow-up publication, he expanded on that and really kind of gave the name esophageal eosinophilia with dysphagia that eventually became eosinophilic esophagitis, and declared it as a distinct clinicopathologic syndrome. Fast forward 15 years, and we finally get around to saying, okay, well, this is a thing, a diagnosis. Let's all get together and think about how we define it and how we should go about then thinking about treating it.
And that was about
that's
when
really
Lauren
important
was
because
diagnosed.
When we have shared definitions, then we can test those definitions and whether they're right or not. And so in 2007, a group of experts in pathology, pediatric gastroenterology, and allergy got together and made the first consensus guidelines for EoE. The next year, in 2008, another big win for the EGID community was having official ICD-9 classification for EoE. And this was really spearheaded from the group, patient advocacy group, APFED, the American Partnership for Eosinophilic Disorders, that's really continued to do just outstanding work in this group of patients. In 2010, we founded our program here at Children's of Alabama, initially called the Gastrointestinal Eosinophilic Disease Program, GEDPA, at Children's Alabama, and Dr. Dimmitt and Suzanne were the initial members, soon joined by Prescott Atkinson in allergy immunology, and really just did some great work, both in kind of setting the foundation for this program, getting some research done and moving the ball forward in that arena, and setting us up to be the successful program that we are today. In 2011, there was an update in the guidelines for EoE, and really that's where the thought about PPI responsive eosinophilic esophagitis came about. And the recommendation at that time was for all patients to have a PPI trial prior to being diagnosed with eosinophilic esophagitis, in part to help distinguish between gastroesophageal reflux disease and EoE. And as it turns out, that was problematic in some ways, but at the time, that based on the evidence, that was our best understanding. In 2013, we hosted our first annual EoE Family Education Conference here at Children's of Alabama. We're celebrating our 7th this year, and it's just been a really wonderful part of our program and something that I look forward to yearly. In 2015, they updated from ICD-9 to ICD-10, and we got a new and more simple to remember classification, and that still holds today for EoE, so K20.0. And then in 2018, the pace of guidelines has quickened, and so we're already at a new guideline dubbed the AGREE guideline, as they were looking for consensus among experts in thinking about how to better define how PPIs are thought of in the diagnosis and treatment of eosinophilic esophagitis. and really pivotally remove the PPI trial from more of a diagnostic criterion to more of a treatment option. In 2018, I was named the director of the EGID program at Children's Alabama. And in 2019, we changed the name really in part due to some feedback from the Patient Education Conference that year. And we named it the Alabama Center for Eosinophilic Gastrointestinal Disorders, or ACE for short. This better reflected our mission and scope of the program. In 2020, we welcomed Dr. Montoya and Brooke Reel. And in 2021, we're here celebrating our 7th annual conference. Looking ahead to the future, there's things that are on the horizon for us. We're continuing to grow the clinical mission to include outreach to local allergists and pediatricians to help close the gap in delayed diagnosis. We know that delayed diagnosis is an issue in eosinophilic esophagitis and other eosinophilic GI disorders. And I think, focusing on pediatricians and allergists, because they're the ones that are seeing these patients before they necessarily get to us. The allergist may see you for your asthma or your eczema. The pediatricians are seeing you for those early days of vomiting, abdominal pain, things that, may clue into the fact that this is maybe an allergic condition of the GI tract. And really my goal is for them to be able to identify and refer those patients as early as possible so that we can do the additional screening. And ultimately, the only screening we have now from a diagnostic standpoint is to do an endoscopy. And so really getting to the point where we can hone in on that decision and decide in a collaborative fashion whether to proceed with endoscopy if the concern for eosinophilic esophagitis or other eosinophilic GI disorders is high enough. We're looking to add more formalization to the transition plan by potentially expanding the program to include adult services at UAB. More to come in the future on that. And establishing more dedicated research and quality improvement efforts. Really, we've gotten to the point where our clinical mission is doing great. We have great folks. I think we're providing really good service, and now it's time to focus on moving the ball forward from research and improving the care that we deliver, not only here locally, but nationally. So I'm really excited to have all of those things be a focus now. Some program highlights from this past year. This is a great poster that we're presenting at our Nurses Week coming up in the next month, and also going to present nationally at the NASPGHAN conference, hopefully in Nashville, coming up in later this year in October. What we did was we looked at, looking back at 2019, all of the patients that were newly diagnosed with eosinophilic esophagitis that came through our program and had not been previously on treatment for eosinophilic esophagitis, and just looking at what patients and their families chose as their initial treatment option. And the conclusions were that we had patients that were choosing all three of the potential treatment options. So we had patients choose PPIs, choose to do topical steroids, or choose to do diet elimination. And you can see, the topical steroids were the most common, but all were represented. And we're really proud because one of the most important aspects of care is shared decision-making. And the fact that people are able to feel comfortable with choosing any one of these treatment options shows that we're giving enough education and control from a family aspect, a patient aspect, that they are free to choose these. So we're excited to share that information more widely. And hopefully this is something that we can build on and start to understand, is there improvement that we can have in this aspect here? Are there ways to do a better job of educating patients? And is there things that we're doing here that we can share regionally or nationally to help other people achieve that same goal of shared decision making? Other highlights include the fact that we were selected as a site to conduct a study that's industry sponsored looking at the use of benralizumab in EoE with Dr. Amy Jacob as the principal investigator here at Children's of Alabama.
Is that a medicine?
We'll all be involved and look for more of that to come. We're not enrolling at this point, but when we do, we'll be reaching out to folks to see if there are anyone that is interested in enrolling in that study. We're currently in the process of updating our local clinical guidelines to reflect recent updates in the eosinophilic GI disease literature, including a lot of literature that's come out adding more nuance to the food elimination plan, and thinking more about should we do a step down approach starting from a 6-food elimination or top 8 elimination plan, or should we be thinking more about doing a step up approach and starting with a more limited elimination and expanding with time? Myself and Dr. Montoya joined the newly formed EGID subspecialty interest group through our national organization, NASPGHAN, which stands for North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition. We're really excited to be part of this group and really collaborate with a group of physicians that are interested in doing better, both in delivering care, but also in educating families and other providers, including pediatricians, in the treatment and diagnosis of eosinophilic GI disorders. And then a really great thing that we've done this year is to establish a weekly meeting with all of our program members with rotating areas of focus, including administrative and quality improvement, journal club, research, and education topics. This has really helped us move the ball forward in some of these projects much faster than we previously were able to without that kind of set meeting and kind of holding ourselves accountable to move things forward. So in conclusion, welcome everybody. I'm excited to have you here. I'm excited to see what is to come with the lectures